Good morning, welcome back. You're currently with me on Tracks FM. My name is KG, and as you know it, every Mondays at 11:15 we would have Health on Tracks coming your way, and of course today is no different. Today we are talking about the best kind of medicine for a headache. Yeah, we are talking to our guest today, Mathuri Krishnan, who is a pharmacist with the Sejangkang Health Clinic in Kuala Langat. Now, headaches is something everyone gets, regardless you're poor, you're rich, you're healthy, you're not healthy. Everybody gets a headache. So with that, let's welcome Miss Mathuri Krishnan to the studio. Hello and welcome.
Good morning.
Good morning to you too. Let's talk. Are you having a headache now because you have to be on radio? No?
I'm cool.
Yeah,
Not
cool, huh?
headache.
Okay, we got to get the temperature up because I'm very cold as well. Right, so let's talk about the types of headaches. All right, now what are the most common types of headaches out there?
All right. First of all, headaches are actually something very common that probably from time to time everyone will go through it. Okay, and feel what is headache like. So we have primary headaches and secondary headaches. All right.
Mm-hmm.
So primary headaches are headaches that are not caused by any other conditions, such as cluster headaches, migraines, and tension headaches.
Mm-hmm.
So the secondary headaches are the pain that comes with usually another medical condition, such as head injury, sinus infection, or high blood pressure.
Mm-hmm.
So the headache is basically something that someone will feel the pain on the head and the face. All right, and they'll feel the pressure.
Mm-hmm.
So it could be throbbing, it could be consistent, it could be a sharp pain, or it could be a dull pain, but some or other headaches are generally nagging.
I think everybody knows what a headache feels like right now, because you know what? Sometimes you wake up in the morning and you're like, oh, I have to go to work. That's a headache. You know. All right. So let's talk about the main causes of headache. Now you said primary headaches as well as secondary headaches. Under primary, you got migraine, cluster. Under secondary, you have it as an external symptom of something else. Now, what are the main causes of a headache?
Okay. What could be causing the headache could be probably stress.
Mm-hmm.
Okay. And then it could be other triggers that could be probably food related. Yeah, or other injuries that a person has, but they may not know that that is actually the cause of the headache.
Wow. So it could be like they say, like you might get a concussion, but you not know about it as well, right? And then it turns into a headache down the road.
Yes, correct. So probably if a person is having high blood pressure, but they might be having headache, but they might be thinking that it is some kind of a normal headache, but it's actually due to high blood pressure. So if they don't get it checked, they will not know.
That is when it's a secondary headache.
Yes, secondary headache.
How about some other stimuli, some external stimuli? Like for instance, like I've heard of cases of light causing migraine. How about smell? Could they cause headaches as well?
Yes, sometimes certain triggers like you mentioned, smell and light are main factors for migraine actually. Yes, migraine is totally different from normal headache. Yeah, normal headache could be just there, and then after that the migraine will be something that is very persistent, whereby even the light will be very bugging. You know, some people, they cannot see light. The migraine gets worse. And some smell. Let's say they don't like this perfume smell. Whenever they smell that, they get headache. Yeah, so they should avoid all these triggering factors.
Okay, absolutely. And like for instance, like me personally, I'm a bit light sensitive. So like for instance, I always have to wear sunglasses in brightness because I do get headaches due to light sensitivity. But then I guess that's a whole different factor right there. But migraines, yes, I think a lot of us have gone through migraines. And as you said, migraines are very different from headaches. I think someone who's gone through migraine, they'll say, please, never again, right? And let's talk about getting it treated, right? So how would you actually treat a headache? What would a patient actually go through?
Okay, so most common, anyone who has got headache, right? The first thing that they will do is they will pop in a Panadol, or it's known as paracetamol. They will immediately go to any pharmacy or even 7-Eleven where they can get it easily, and they will put in paracetamol. So paracetamol is a common painkiller that we can use for headaches. All right, but besides paracetamol, we also have the stronger ones, which is called the non-steroidal anti-inflammatory drugs, which is known as NSAIDs. Okay, so the NSAID drugs are like ibuprofen, naproxen, diclofenac, which is your Voltaren, and most commonly that everyone will know is mefenamic acid, which is Ponston. So these are anti-inflammatory drugs, which mean that apart from it being a painkiller, it treats the inflammation that is triggering the headache as well.
So for primary headaches, they're very, very effective.
Yeah, primary headaches you can try with paracetamol first. But if it's really severe that it is not going off with the paracetamol, then you can opt for something a little stronger. That is the NSAIDs. Yeah, which is this Ponstan probably.
Okay.
That you can also get in the pharmacy.
And those are all brand names, right?
Yes, correct.
Brand names. And then there's also the generic ones, I think.
Yes.
I believe. And what is an aspirin? Is that part of this NSAIDs thing or something along the line of that?
Yes, aspirin is also a part of it, but mostly aspirin, they will not straight away prescribe for as a painkiller because aspirin is mainly used as a blood thinner.
Oh, okay.
Yeah.
All right. Okay, so since we've already answered some of the types of headaches, the main causes, as well as how we treat it, what we're going to do is we're going to be taking a very short break, and once we come back, there's more to talk about, especially the medicine that you can use for headaches. Now, we have touched briefly on it, but we'll be back and we'll talk more about that. All right, so ladies and gentlemen, we are talking to Mathuri Krishnan, who is a pharmacist with the Sejangkang Health Clinic in Kuala Langat, and our topic today is best medicine for headache. Now, if you do have questions for our pharmacist today, you can definitely put them on our Facebook live page. Currently the video is going on. We will be back right after this song. Don't go anywhere. This is scar tissue that can also cause a headache, I believe, down the road. I don't know. Well, anyways, we're talking about best medicine for a headache on Health on Tracks today with our guest Mathuri Krishnan, who's a pharmacist with Sejangkang Health Clinic in Kuala Langat. Now, we spoke about the types of headaches, and there are primary headaches as well as secondary headaches that can be caused as symptoms as other diseases. Also, the main causes of headache, stimuli, we got stress, we got other kind of food-related as well as injury-related triggers, and we spoke about how is a headache treated as well. And right now, moving on to the next question, Ms. Mathuri. What are the types of headache medicines that are available? I think we touched on that a bit, right? We spoke about paracetamol as well as NSAIDs. And are those the most common one, or are there even different kinds of medicine other than that?
Okay, like what I mentioned before, those are the common ones that is available. So when you're talking about stronger doses, right? So what a person's supposed to do is they are supposed to get to the doctor. Okay, if they have really bad headache which is not going off just by paracetamol, they should go to the doctor and get it treated. So the doctor might prescribe something which is of higher dosage that they might need to use frequently, like probably for a duration of 2 weeks or so to see what is the whole cause and further investigation on their headache. Okay, so generally for the over-the-counter medications, right, it has to be bought from a registered
Pharmacy.
shop, pharmacy, pharmacy or any clinics. Okay, and then that medicine will be only given to you, dispensed to you by a registered pharmacist. Yeah, why do we say so? Is because the pharmacist will be able to provide proper counseling to you, and they'll be able to advise you on side effects of the medication.
And they also be able to look at your dosage. They can gauge the necessity and all of that, right?
Yes, everything else. And then for the tips of the over-the-counter medication, right? Okay, so what I would like to say is, firstly, what you need to know is you need to read the label. Okay, when you're purchasing a medicine, you need to read the label. So you need to know the active ingredient in the medication. Alright, secondly is watch the dose. Okay, do not take anything that is more than the recommended dosage.
Yeah.
Okay, this can lead to serious side effects.
Especially like paracetamol, you said that since it gets metabolized in your liver, over usage can cause issues to the
Yes.
the liver itself, right?
Correct. Yeah. So, and then avoid over-medicating. Okay, if you see in like 2-3 hours your headache is not getting better, don't go and pop the medicine again. Yeah. Take another paracetamol, and then not okay, another paracetamol. So it's just going to cause you a lot of side effects in the long run. All right, and then make sure you consult a doctor or get advice from the pharmacist. Okay, especially if you're going to take the NSAIDs, okay, the non-steroidal anti-inflammatory, you need to inform the doctor if you have other underlying issues such as you've gone for a surgery beforehand, or you have asthma, or you have any ulcers, kidney disease, or liver issues. So you need to let the doctor know, or even if you're on any blood thinners like aspirin or clopidogrel, all you need to tell the doctor in advance. And then lastly, you should avoid combinations. Okay?
Yes.
Don't mix and match as you wish.
Like I mentioned earlier, right? Like what my grandmother used to do, cola as well as paracetamol.
Yeah.
I'm not too sure how that lady lived till that age, but please don't do that.
Yes, please don't do that.
Yeah.
And even then, don't mix a few medications together. Like you want to get rid of the headache as soon as possible, so don't go and take paracetamol with Ponston and something else. Probably some other herbal remedy or something that you might think will get better. So all that might just cause more damage to you. Yeah, and increase the risk of drug-drug interaction.
Yes, absolutely. Leave that to the pharmacist as well as the doctor to see what is good for you, because sometimes we tend to mix and match. It can cause major issues to you. All right. And let's talk about taking headache medicine every day right now. When I read about headaches recently, it said that having continuous headache, now that could be signs of another underlying there might be another disease. You shouldn't be having headaches every day, right? If it's just a primary headache, right? So you shouldn't be taking medicines for headache every day, should you?
No, you shouldn't be taking medicines every day for headache. If you're taking every day for headache, then you should get yourself checked. Okay, so the Panadol, like I mentioned before, that you can take for headache, right? You can take about 1 or more than 2 to 3 times per week only. Don't take anything more than that. So if you're taking anything more than that for your headache, you need to get medical advice. You need to get yourself treated, which means there's something else. Yeah. And this something else could not mean that, it is very dangerous or something. It could be just your lifestyle, your stress, your food intake. Okay. So if you're going to look at that, right, when you see headache education, you need to have like a headache diary. If let's say you are having headache very frequently, you have a headache diary. So you can write it down, like how frequently in a day you get your headache. And you can see what are the triggers. All right. And then you can seek treatment when it comes again. And then when it comes to lifestyle changes, all right, you should not skip meals.
I need to tell my wife that.
You should not skip meals, especially breakfast. Breakfast is the most important meal of the day.
Absolutely.
Yeah. And then get at least 7 hours of quality sleep.
7 hours of quality sleep.
7 hours of quality sleep. Exercise 30 minutes a day. All right. Drink about 6 to 8 glasses of water. All right. And identify and avoid head triggers. Okay, this is very important because most people start their day with caffeinated food. Okay. For example, caffeinated food and beverages like coffee, tea, soda. And then when you're really drained out, you go for energy drinks. And then chocolate.
I love chocolate.
Yeah. And junk food, of course. All right. So when you start your day with just a cup of coffee, avoiding your breakfast, you just take a cup of coffee. So that could be your trigger, but you may not know it.
So the caffeine itself is a trigger?
Yes, the caffeine itself is a trigger. The coffee, the tea.
Okay.
All right. And then you go for chocolate because you think sugar gives you energy. So you go for chocolate. So that chocolate is actually a trigger because there is caffeine in chocolate.
I did not know that. Okay, doctor, to be very perfect. I've been taking only chocolate drinks in the morning, mainly because I think that I shouldn't do caffeine in the morning. I had no idea chocolate had caffeine in it.
Yes, chocolate has caffeine. Cocoa has caffeine.
My life.
Okay, and then when we talk about food, right, there are some food which has got chemicals as nitrates and tyramine. All right, nitrates, it can be found in deli meats, sausages, and pepperoni. And also tyramines in aged cheese and pizza. So some people, when they eat heavy loaded cheese loaded pizza, they will say they have headaches. So it could be the cheese.
Could be the cheese.
Yeah.
Yes.
So you need to really identify all these kind of things, the issues, the triggers that actually causing you the headache.
This is almost as severe as finding your allergies.
Yes, correct.
Wow, and very similar too. Like what? You know what? I don't have triggers for headaches except people, but we will talk about that later on. Now, is there anything else that you'd like to add to that statement?
Yes. For this, right, you can also have some strategies at home that will help you with headache.
Okay.
All right. So probably the first one will be rest in cool, dark, quiet room. So this will be really helpful for migraine. Yeah. And then use relaxation strategies. Probably listen to some calm music or some, aromatherapy oil or something diffusers that will really help you to reduce the stress. And then worse still, if you feel hot and, the headache is really bugging you, you can put a cold compression on your head. okay, or getting a cold shower, all right, and getting adequate movement. So if you're stagnant in one place, right, and you're doing something or you're focused on something, you might have headache. Yeah, so just take a break, wake up, go for a quick walk around, get some fresh air and come back. It will really help.
So between a cold shower and a hot shower, which is actually more beneficial for a headache? Because I've heard people say, you know what, you take a hot shower that helps your blood flow faster and all that, it helps it better. Is it true? Is a cold shower better or a hot shower better?
Well, it actually depends. Okay, if a person is having let's say feeling really cold and that is that's causing the headache, so you take a nice warm shower to calm yourself, so your blood flows better. So if let's say you are really hot, you went out on a hot day and you're having throbbing headache, migraine because of that, so you come back and take a cold shower, so you will feel better.
So all of the strategies are very, very conditional, so they have to be at that time, has to be used for that.
Yes, correct. So that is why you really need to know the trigger of your headache.
Okay, I think that should be, because I've never heard anyone say that, find the trigger for your headache. I think that's a very, very good thing to say and a very, very good thing to understand as well. But you know what, right now, Miss Mathuri, we're going to be taking another short break. We'll be coming right back after this song by The Pretenders, and once we come back, there's more to talk about medicines for headache and also people who like to seek for alternative medicine as well. We'll talk about that in just a few moments. Alright, so don't go anywhere, ladies and gentlemen. We are talking about best medicine for a headache with Miss Mathuri Krishnan, the pharmacist at Sejangkang Health Clinic in Kuala Langat. Right here on Tracks. She's a girl and she's on fire. She should call the firehouse, I guess. Is that what they're called? The bomba? What's bomba in English, Val? Oh, you cannot think. Okay, well, anyways, seems like we are lost for words, but you know what? We're talking about best medicine for a headache today. We are talking to with our guest, Mathuri Krishnan, who's in the studio today with us, and she's a pharmacist with the Sejangkang Health Clinic in Kuala Langat. All right, so we're talking about headaches. We spoke about primary headaches, secondary headaches. We also spoke about stimuli that can cause headaches, some of the options available to cure your headaches. Now let's talk about alternative medicine, Miss Mathuri. Is there any alternative medicine to actually cure headache other than, as you said, over-the-counter medication?
Alright, usually it is just the over-the-counter medication because, as I said, headache is something very common and not very severe. Unless you're having severe headache, then you don't have alternative medication towards it. But other than that, like what I mentioned before, alternatives could be something like yoga, probably to relax yourself, meditation, exercising. Yeah, all that could be the alternatives to headache. Yeah.
And alternative, some people, when we say alternative, they immediately go to herbal or they go to, like old-timey kind of medicine. But those can also be a bit dangerous, right? Because earlier we were speaking to a nephrologist from the Sedang Hospital. She said that sometimes herbal medicines can also cause kidney damage. Sometimes herbal medicines, can they also aggravate your headache?
Yes, now that you mentioned about herbal medicine, I would like to stress here that one should not combine herbal medicine together with modern medicine. All right? If in case you want to take some supplements or herbal medicine, you should have a gap of at least 2 hours before you consume. So meaning you take the modern medicine first, and if you think you want to go for something herbal, you can take 2 hours later.
Okay.
So that you avoid interactions.
Yeah. Okay.
And another thing about herbal medication or supplement is that you must make sure that it is registered with the pharmacy board. Yeah. Don't take something that is just sold on Facebook just like that, or it is recommended by someone in the Pasar Malam or something that you might be convinced. Okay. So this is very important. Make sure the hologram, the KKM hologram is there before you take any herbal medication.
Yes, make sure it is registered. If you're going to put anything into your body, make sure that it has been tested. It has been seen whether it can be detrimental or it is actually useful for your body. Because, I think better than layman, I think KKM understands what is good for the human body itself. Now, let's talk about the differences between children and adults in terms of headaches. Are the triggers different? Are the stimuli different for them?
Okay, children generally are very much more active. They are stress-free compared to the adults these days.
Yes.
All right. But if a child comes and tells you that he or she is having headache, all right, on a general time or day, okay, if they see, probably firstly you should see if they are using the screen too much.
Yeah.
too much of TV, too much of handphone. Okay, so that could be a cause of headache to them. Secondly, if they are not well, if they are having fever or if they have been having diarrhea, then you should probably look into it. All right. Otherwise, if your child comes and tells you, I'm having headache consistently in a day about 2-3 times, and it repeats about few times a week, then you should look into it. Probably they need medical assistance, or probably they would have had a fall that the parents may not have noticed. Yeah, that could be a headache.
So when a kid or anyone below the age of 12, they actually have a headache, that is actually cause for concern.
Yes, correct.
Absolutely. Now, before we end, I would like to ask, is there anything else that you would like to add for our listeners, and what is your take-home message?
Yeah, so my take-home message here will be once again to say that headaches are actually a common condition. All right, don't get too worried about it. Okay, with some lifestyle modification and everything, or your trigger, it can be weaned off. Okay, and of course, these headaches vary from moderate to severe intensity. If you get occasional headache, okay, and it is not going off with the over-the-counter medications, then you should seek advice from your medical professionals, okay, of what is right for you. And then whatever that is prescribed, please take it accordingly. Okay, don't overtake it.
Yes.
Okay, and when if this headache is actually affecting your daily life, then it is something to be concerned of. Okay, you need prompt treatment. And generally, there is no best medication for headache.
Yeah.
Okay, there is no right or wrong or best or not best like that. Okay, you need to know, because different types of headache need different type of treatment. Okay, and always discuss with your doctor or your pharmacist for any potential precautions or side effects of any medication before starting the treatment. All right, and the right medication and dosage combined with healthy living can provide long-term headache relief.
Absolutely.
Okay.
Very well said. So for every different instances of a headache, there's different options, there's different medicine. Every different people, they go through headaches differently. So guys, if you have a headache and it doesn't go away, first things first, go meet a doctor. All right, get the proper medicine.
Yes, and if at all you have any inquiries regarding the use of medicine, please call the National Pharmacy Call Center, NPCC, through 1800-886722 from Monday to Friday, 8 a.m. to 5 p.m. except public holidays.
All right. So even doctors and pharmacists need a day off on public holidays. But yeah, you can call them any other time. By all means, go ahead and do it. And thank you so much, Miss Mathuri Krishnan. Is there anything else that you'd like to add for our listeners? Or is it all?
Yeah, that's all from my
right.
side. Thank you very, very much for giving me this opportunity to share on this topic.
All right. Absolutely lovely having you here today. We wish to have you again in the future. Maybe we'll talk about other kinds of medicine for other kinds of diseases as well. All right. Thank you so much, Miss Mathuri Krishnan. She is a pharmacist with Sejangkang Health Clinic in Kuala Langat.